Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the MyoHacker Podcast is your guide. Hi, I'm Karindy, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. Welcome, my friends, to the MyoHacker Podcast. With me today, we have Melissa Nealy. She is, background IBCLC and now is a midwife. So, Melissa, tell us a little bit about yourself. Tell us what your current practice is, and then we'll get into the history and how you went from IBCLC to midwife, because it's such an incredible journey.
Sure. Depends on what day I tell the story as to what gets told. So I am Spiral Path Midwifery. I have been out on my own this is year 3. So super fun.
So let's talk about that, because you had another profession before
I've had so many
midwifery.
Yes.
Wait. Now is the time to talk about the pageants. Can we just do that real quick?
So when I was in college, I was going to be an opera singer or the next Broadway star, whatever. And so I was in music school, and I was a vocal performance major, and very stubborn and very much, this is what I'm going to do. And so I have to qualify, because I was not in a sorority. I was in a music fraternity, because that made it more serious. And I met some amazing humans there. And one of them, my big sister, was, her name's Betsy Eshkrat, and she is very big in the Miss America pageant world. So she encouraged me. My first senior year, she was like, I really think you would benefit from pageants, because I really struggled with performance anxiety, and in the practice room, people would be like, wow, you're doing so great. This is lovely. I'd get on stage and they're like, your eyes go dead. They just gloss over and
Guys, the opposite of Melissa when you interact with her. There is not a dead moment with Melissa ever. She has bright turquoise hair. So I'll just say from the get-go, we are lively. Okay, so you had dead eyes when you got on stage.
Dead eyes, and so you should do pageants. It'll get you lots of performance experience, and boy, did it. And, you have to do interviews, and it's just really good training if you want to be a performer. I think I did 2, and then I won my 3rd. And so I was Miss East Texas, and I went to the state pageant. And I mean, dresses and makeup and hair, and you may not leave your house unless you look like Miss Texas. You want to be Miss Texas? You need to look like Miss Texas all the time. It's something that I've legitimately had to work through in therapy, because I got kind of triggered because I was constantly being judged for how do I look? Not so much who am I and what can I do, but there were lots of benefits, and I've come a long way since there. But yeah, so it did kind of get me out of my shell. So it did what it was supposed to do. And then got out of school, and I was going to go to grad school and be an opera singer. Also, I had a guy, and I liked him a lot, and I wanted to get married and have kids. And I was like, okay, I'll be a teacher. So I taught elementary music for 6 years, and then taught middle school choir for 1 year after having my daughter, and it just about killed me. Middle schoolers are jerks to each other, jerks to their teachers. One-on-one, they're fine. Get them in a group, and they are like killer whales.
I know.
It's like a pod of killer whales around a seal. It's just not my favorite. They're amazing. There's so many hard things going on in middle school. And I totally understand it. And I am not the person to teach middle school. So I started staying home with my daughter, but I never really stopped working because I am incapable of that. And I always wanted to be a midwife.
You are a multi-passionate person, as we like to say. Yes.
There we go. So yeah, I found out midwives was not just biblical thing around Moses. This was an actual job about a year before I conceived my oldest child, and was like, I want to do that. Oh, wait, I just got my graduate degree. I just got a master's in music education. Maybe
Whoops.
I should just take a few years off. I'll go back into teaching when my kids are older. And that did not work out. And I was like, no, I'm going to be a midwife, and started doing lactation consulting and doula work and birth assisting and student midwifery work basically as soon as I could get my husband on board.
So, including being an IBCLC, which that is how Melissa and I crossed paths years ago. And we have like co-taught together and different things, but you're an incredible IBCLC. So there has been a part of me that has been sad to see you leave that, but I also get to see how you bring that in to
Yeah.
what you do now. So tell us about
Yeah.
that.
Okay. So from music education, there's a Hungarian music educator philosopher named Zoltán Kodály. And he was asked once, when should you begin music education? And at what age? And he said 9 months before the birth of the mother.
Because the mitochondria?
So, because like there's no time that's too early. You need to be exposing the mother when she was in the womb to music. And then like it's not ending. It's you should always be exposed to music. You should start hearing great music when you're in utero, and you should continue to learn about the arts. And like that was his philosophy, that there's no age too early. You should just absolutely just be entrenched in music and arts and whatever. And there's some communist stuff around how that conversation even became a thing, but he's really cool. And when I was doing lactation, I just kept being like, because I'd get clients, and my favorite clients to get were ones that came from the midwifery world. And I had a lot of midwife friends, and I was assisting a lot of these people. I was studying with a lot of these people. So I would get their clients as my lactation clients and be like, okay, at least we're not starting from zero. Because a hospital-based client, a lot of times we are starting from, they just don't know very much about lactation. There's
Right.
not this underlying, they've already had a conversation about what feeding timing looks like or supply equals demand. That tends to come with a midwifery experience. They've got some breastfeeding education through being a midwife. But then I would also see sometimes, depending on philosophy of the midwife versus philosophy of this lactation consultant, we would have differing views. And then it felt like a battle. Well, my midwife said, basically, you're full of crap. And I'm going, whoa, okay, I see where they're coming from. And I understand. This is why I started getting very good about going, is tongue tie an actual thing? Is this an actual, like getting really good at here are the facts. I can't tell you what to do. I can tell you this is the evidence I have to support what I believe, but you are your own person. I understand your midwife's coming from a different viewpoint, and that's fine, but you do what works for you, not what your midwife's telling you to do, not what I'm telling you to do, what works for your family. And then it was like, I
Yes.
need to be a midwife. I need to start these conversations 9 months ago.
Yeah.
Why am I like, I
Yes.
don't like having to start after the fact. I also don't like that it felt like sometimes that relationship piece would overwhelm the logic piece, which this is how we're built. Like, we let relationships be like, well, all my friends say blah, so it must be true. And that's not always true about everybody, but like that is often how we are built. We are very social people.
Which again is why junior hires can be so
Right.
nasty at that age. It's the social component. But anyways.
Yeah. So I wanted to start sooner. I wanted to start having those conversations. I also wanted to start doing prevention. Like, what if we could teach moms to move their tongue while they're pregnant? And what if we do nutritional support? Do we decrease how many kids are needing these tongue tie interventions? And I don't know what the answer is yet, but what if we can have those conversations, at 10 weeks of pregnancy or 12 weeks of pregnancy?
Yes.
What if we are having the conversation? Because a lot of times with my lactation clients, I'd be like, so I have these theories. This is my information. Please be doing these things before you get pregnant with your next kid. And then let's try that. And I have seen it work. I have seen it where a subsequent baby then didn't need a tongue tie release. They may have still had a tie, but we could work around it with exercises and release and chiropractic, not necessarily a surgical release.
Yeah.
And I'm like, okay, so it's partly, I want breastfeeding to work. I want bonding to work. I want these moms to have a really good experience. It doesn't mean it's easy. God, I wish it was easy. And that's my number one conversation with clients is natural does not equal easy.
Right.
So
So pretend I'm one of those clients that's come in. Take me through that. Like, I'm not pregnant yet and I'm wanting to know, like, what can I do? What is that discussion? What does that look like when you see someone? How do you fill them in with that information? Walk us through that. I'm sure everyone is like, I want to know, what can I do?
So first off, I say, hey, my favorite thing, I am a nerd and I like blood work. I really like blood work. I like knowing where you're at because I don't want to give advice that isn't going to work for your body. So like I'll have somebody come in and we run their blood work and their platelets are low and we're starting out low. They're not terrifyingly low. They're not like pathological, but like when you're pregnant, your platelets are going to decrease. So, okay, let's work through that aspect right now before you're pregnant. Okay, most women are low in iron. Iron dictates so many of our physiological functions as human beings, growing another human. Let's do that. Hey, I'm not going to tell you to do genetic testing, but have you heard of this thing, MTHFR? Or all of these interesting genetic aspects that are controlling. There are things we can do. There are proteins we can have. There are amino acids we can have or be missing, like that glutathione component, N-acetylcysteine. N-acetylcysteine is supportive of the liver. It's very helpful in supporting glutathione production. Let's get on some N-acetylcysteine. It's not going to cause any harm. Let's try this. And let's be doing these like exercises because your baby is learning from you in utero. So for instance, there are studies talking about like muscular tone. A mom who is muscularly toned and using her muscles during her pregnancy is more likely to have a toned baby. So we want to be doing things with our body to help encourage baby to have the optimal outcomes. And one of those is moving our tongue around our mouth. And then we talk about a little bit tongue function. We're supposed to be suctioning our tongue to the roof of our mouth when we are not eating or talking.
It gets in the way if you're trying to talk, to have it suction there. Yeah.
Indeed. So and then we'll maybe do, like, especially if they're presenting with, or they had a baby with me before and it was tongue tied, or I've been their lactation consultant. I'm like, okay, it's a prevention's worth a pound of cure. If you are coming in and telling me you have a history of a kid who is tongue tied, let's start doing these tongue exercises. I might even do like an assessment on the mom and be like, hey, stick your tongue out, suction your tongue to the roof of the mouth, pull your jaw down. How far can you drop it? Okay, now drop your jaw all the way. Okay, doing a little bit of that. Sometimes people just walk in and Karindy, I don't do this half as well as I'm sure you do, but like somebody walks in and they've got a little bit of a lisp. And I'm like, oh, we're tongue tied. And it's a, hey, has anyone talked to you about tongue tie? I notice you're wearing braces. Hey, have you had a baby before be tongue tied? Okay, let's talk about that. Let's get on some N-acetylcysteine. Let's make sure that your B vitamins are folinic acid or methylfolate, depending on how you process those. Let's make sure you're having methylation support. Let's get you on those supplements. And then let's work on getting your tongue functioning as well as it can be. Have you ever considered a tongue tie release? It might help you, but it also increases your oxygenation. It also helps decrease your risk of having preeclampsia. There are multiple aspects of the mom getting herself addressed that will influence the baby, even if it doesn't influence the baby, whether they have a tie or not. So then it's, again, and this is all personalized because sometimes they don't have a tongue tie. They've never had a kid with a tongue tie. They're like, what are you talking about? And so we don't talk about this stuff. So it just depends. But like, I know two women right now that I was like, we're tied. Like they literally started talking to me on the phone and I'm like,
You can hear it. Yeah.
and that's okay. Let's talk about this. Let's do this. Sometimes people don't want to hear about it and then we don't talk about it.
Absolutely.
Um,
Yeah.
so it's just person to person specific. And then ideally, we're concentrating on suctioning your tongue, using your tongue to lateralize food between your
Mm-hmm.
gut molars, really focusing on that as well as that methylation support. And then ideally, we have a baby that hopefully comes out and just latches and doesn't cause pain and has a functioning tongue. And I've absolutely seen a tethered baby with a very functioning tongue.
Yeah.
I love when we say, it's not that bad of a tongue tie. It's a
How
long,
they're
stretchy
how
tie.
they're functioning. Yeah.
It's a
Yeah.
long, stretchy tie that should work better than it is because,
Mm.
oh my gosh, what is this kid doing? They're holding on with their gums. No wonder you're saying you have pinching. There is no wave motion of the tongue. There is no cupping of that tongue. The way the tongue should be functioning, your baby's literally doing like none of it.
Mm.
They can't
Mm.
extend, they can't cup, and they can't do a wave motion. And I need them to do all three.
Right.
This baby is doing great because you have a massive oversupply. I am so glad for you that your baby is like in this 88th percentile for growth. And they came there from the 40th because they were not born there. However, they're basically getting on, hanging on for dear life, and surviving the letdown. So it might be a good idea to start working on this.
Absolutely.
So then I can get them to a lactation consultant faster. Then I can get them doing exercises faster.
So, what are your thoughts? Well, let's talk about this because I will see pregnant women and the progression of myofunctional disorders that they have through pregnancy, they change. So, I would love for us to talk about the influences of, or just what is going on from a hormonal standpoint, changes in the body, why there are certain stages, and even just where the baby is at and how that impacts breathing, and just why all of a sudden they'll be like, oh my gosh, my sleep apnea, I'm not sleeping. And then even just some of the chemical changes that happen towards the end of their term. Bring us through that if you're all for it.
Oh, oh, okay. Okay.
I'm ready.
So early on, not as much, right? I mean, there's hormonal changes and we've got the nausea going. So we may
Yes.
have increased reflux. We may have increased vomiting, so more stomach acid in the airway in that space, more burning. So they might be doing more mouth breathing. Also, the capillaries tend to swell in the nose, and so they're more likely to have nosebleeds. They're more likely to feel like they have a stuffy nose or rhinitis. Also, their immune system is depressed, so they're more likely to get a sinus infection or just catch the latest cold or flu that's coming through. And that in and of itself is enough to make more mouth breathing and more nasal discharge, just everything that goes with that. Then, as the baby is getting bigger, we've got more relaxin in the system.
There we
Our
go.
blood
Yeah.
volume has increased by 50% by 28 weeks. And so now there's extra stress on all of these systems. Their immune system is still slightly depressed. Their white blood cells should be pretty low. Their platelets are decreasing. Their red blood cells are, should be increasing. A lot of times because of the blood volume, they dilute, but it's complicated. So they're having these huge changes to the amount of blood flow to the different areas of their body. Plus, they have a baby that's now all of their internal organs are pushing up on their diaphragm. And so when that diaphragm is pushing up and it's pushing on the lungs, and we do have decreased lung capacity when we need increased oxygen, we have increased stroke volume in the heart because we've got this increased blood volume, and we need more oxygen because we've got a baby that we're growing. And if you already have a small airway or you're not doing the nasal breathing already, you are so much more likely to just go, just to exist. And then you try to go to sleep. And we've got increased pressure on the diaphragm or horizontal. We've got all of the hormones of relaxin. We've got all this progesterone and estrogen that are massively climbing. And we've also got cytokines that are increasing inflammation. So pregnancy is an inflammatory state. It has to be.
Can you just clarify, why does it have to be?
Oh, well, it's okay. I should rephrase that. Pregnancy is an inflammatory state. A baby, I don't want to get into like philosophy or ethics, but I think babies are symbiotes. But it feels awfully parasitic unless mom is hurt.
Yeah.
If mom is hurt, then the baby will send stem cells to mom to help repair her body, which is really cool. That's that symbiotic relationship. However, a baby inserts itself into the lining of the uterus, changes how the blood flow is there, and immediately starts sending hormonal signals to the body to depress the immune system and to increase some inflammation. I maybe shouldn't have said it that way. It is an inflammatory state. Babies are inflammation. Anybody who's a mother can say that once they're on the outside. They're definitely inflammatory.
Yes.
I love them, but your body is actively not killing a parasitic invader. That depressed immune system. That's why your immune system has to be depressed. So your immune system does not go invader alert. we need to do something. So
Mm-hmm.
we have hormonal chemical signals sending out and telling the body, hey, we're going to need more glucose down here. We're going to need more iron. We're going to need more calcium. It's an active state in terms of metabolism, in terms of, oh, I can never remember. It will break down your bones if you're not getting enough dietary intake to grow
Mm-hmm.
the next generation. If you're
Mm-hmm.
not getting dietary intake of whatever supplement, it will steal from you because the next generation matters. And this is not
Mm-hmm.
the baby, it's a reproductive system. It is your body saying the next generation matters.
Mm-hmm.
And we need
So
to
we're taking
protect
this from your
that.
bones.
Yeah, it's fine. You'll be fine later. It's fine. But it's also why it's so important to support a mom's natural glutathione production because we can have too much inflammation. And if, again, it's that, did you enter pregnancy already inflamed? Did you already have a little bit of liver inflammation? Okay, well, now we've got extra cytokines, we've got extra inflammation. Now that liver that was already a low level annoyance to our body is going, oh God, okay, hey guys, I am extra taxed because I am doing the processing for 2 people right now. And then I was already having struggle bus times and I need more support down here. And usually the way that I'll make that known is skin stuff, rashes, or I'm breaking out more, or eczema, or having flare ups of any of those acne, rash, eczema, or you might get pups. In an extreme case, you might end up with cholestasis of the liver in pregnancy. So we really want to support all of your systems. So entering in pregnancy with the least inflammation possible makes the whole pregnancy better because, yeah, it just is an inflammatory state. Babies are inflammatory. They have to have that inflammation so that they can get the nutrients they need, so that they can activate the systems to get those nutrients into the baby. So like the placenta is going to make you a little bit more insulin resistant because we need more we need more sugar in the blood because the baby needs that. And again, it's one of those, where did we start? Did we already have a little more blood sugar? And did we already have a little bit more insulin resistance? Now we add the placenta. Now then you get gestational diabetes.
Mm-hmm. Which,
I kind of went a rambling and I
no, I
don't
love
know
it.
that I actually
So,
answered the
okay,
question.
no, this is a part of it. I interjected because I wanted to speak to the inflammatory state of pregnancy,
Bring it.
because this is a part of, I'll be working with a patient and as they're going through their pregnancy, they're like, my symptoms are this part of it. And it tends to change. Like I said, every couple of weeks, it's kind of like we have a different pain point, but that inflammatory background is there. And so there are certain things that it is a little bit of me speaking into, some of this will be better once you are through this. Now,
Absolutely.
breastfeeding has its own then cascade of different hormones.
Right? Massive
So
switch.
yes, yes. So there is that, absolutely. But I do also just want to speak to then that change of where the baby is at and
Like
how, like,
physically in
towards
the
the
body.
end, yes, and when they drop, can you speak to when that is? Because all of a sudden they're like, I can breathe
I can
again.
breathe.
Yes.
And it's different for everybody. You can have somebody who does not drop until they're in labor. And they're like, somebody's telling me about babies dropping. I don't know what they're talking about. I've had 5 babies. They don't drop. And I'm like, well, obviously they do because they come out.
Right, right.
But not everybody has that experience of my baby dropped. And it can happen up to 4 or 5 weeks before you have a baby. But it can also never happen until you have the baby. And everybody is different, but it's usually right there at the end. I have had somebody who they're like, wow, baby dropped. And they do, they start measuring. All of a sudden, they're measuring a little bit behind when they'd been measuring on track, or they've been
Yes.
measuring ahead and now they're measuring on track. And
Mm.
you can see it. Like somebody will walk in, I'm like, oh, wow, your belly's lower. And they're like, really? I'm like, do you feel like you can breathe a little bit better? Absolutely. So what's happening is you've got uterus, right? And it's pushing up against the diaphragm. The diaphragm's that upside down bull muscle under the lungs. So as baby's pushing and growing, they're pushing up against that diaphragm. A lot of your internal organs fall behind the uterus. And as it's right up here, it's hard to breathe because your diaphragm is literally being pushed up into your lungs by a baby. When babies get deeper in the pelvis, they go here. Now your uterus is still up here, but you've got room. Your diaphragm has some resistance. So like my singer clients, or when I was pregnant, I could really feel that diaphragmatic support because I had this resistance against my diaphragm. So you can
Mm.
still feel it once baby drops, but it's less. And when there's less diaphragmatic resistance, you've got more space for your lungs. And it's so nice. It's so lovely because, yeah, you can have people who are like, I just climbed the stairs and I can't breathe. You're like, yep. Keep climbing those stairs though, because I want those lungs to push against the diaphragm. I want you to keep moving your pelvis. It's going to be great. But then once baby drops, they're like, I climbed the stairs today and I'm not out of breath. Yeah, because it does. It's literally just lung volume. You've got less resistance with the diaphragm as baby drops.
So, speaking of oxygen, when we are pregnant, we are needing that oxygen, obviously, because we're building this baby. Speak
Yeah.
to, like you said earlier, you are seeing really low levels, or just they are lower than they should be of iron. And well, because I want to talk to, so oxygen
Iron being the
is,
transporter for
yes,
oxygen.
yes. So I want to speak to that.
Love that this is becoming part of the conversation because I saw like a social, I thought I was battling and would be battling for the next 15 years because it takes 17 years to get evidence into practice. We've got all of this evidence out there about around ferritin. So ferritin is your body's safe storage system of iron. If you think about like bank account, when people are told in pregnancy, you have low iron, that's actually probably pretty scary levels of ferritin because
That's what I
that
was
means
thinking.
your ferritin level is so low that now even your hemoglobin is being affected. And your body's ability to transfer oxygen to all parts and all systems is now affected. We usually have some flags that ferritin is dropping earlier on, but they're often similar to pregnancy symptoms. Oh, you're dizzy. Oh, okay, cool. Oh, you're tired. Yeah, of course. Tinnitus, that ringing in your ears. Oh, that's just a pregnancy symptom. There's a lot of these. Oh, that's just a pregnancy symptom. That's actually a pathology of a missing nutrient. And there are so many nutrients we can be low on, and lots of them have crossover. However, most women in America and most women that I see do not make a regular habit of eating organ meats. And I will put myself out there. I am one of those people. I think organ meats are icky. I cannot do liver. It's just not going to happen. It smells bad. The texture's bad. No, I know how good it is for me, and I am not going to eat it. I can manage heart. I don't think I can handle any other organs. But those cultures where they do have organ meats, the ferritin levels are significantly higher. We're not seeing this constant, wow, your ferritin's crap. So ferritin is what you really want to be looking at in terms of iron because
Okay, our
that's your storage.
doctors that are not midwives, are just OBGYNs, are they
No,
looking at ferritin?
maybe somebody somewhere is, but in the large scale, no.
Because
So
that,
much, no.
I didn't know I had low ferritin until after having both my boys. Because I never was like, they were like, oh, you're not actually anemic. But I had enough signs that they would be like, you need to take things. And then every time I would try to donate blood, not while pregnant, obviously, but I would try to donate blood and they would always reject me and say, no, you cannot. And I'd go then get a lab test and they'd be like, you're not anemic. And it wasn't until I got into the functional medicine just awareness, tested my ferritin and was like, this, how am I functioning?
Yeah. So that's what happens is when your ferritin is low and your hemoglobin is not, you are having your body, there's something called transferrin that is zooming the iron around, just trying to keep things going. And it's trying so hard to keep you alive. And it's like, I will keep you alive, I promise. We'll keep the system going. We'll keep your blood flow going. You don't really need to recall words. So that's going to go. We're going to decrease how much oxygen's going to your brain. So you're going to feel depressed because you are, in fact, actually dying. Which depression, you feel like you're dying. You feel like the world is just awful. Anxiety, opposite swing of that, where it's too busy because your brain isn't getting enough oxygen because your iron is going. Yeah, brain can deal. We need to keep heart and lungs going. Liver, that's okay. So you get all of these like depression, anxiety, exhaustion. hopelessness, muscle twitches, like all of these things from having low iron, but your hemoglobin looks fine. So I was like, I don't know what your problem is. You're not anemic. No, you're hypoferritinemic. It's different.
Let's take a moment to talk about one of my absolute favorite tools for supporting health and wellness at home, ozone therapy. You know I'm a huge fan of finding effective, science-backed ways to support our body's natural immune defense system. That's why I've been using the Stratus 3.0 ozone generator from Simply O3 for years. Whether it's tackling ear and sinus issues or boosting overall health, incorporating ozone therapy at home has made it so much easier for my family to overcome illnesses and proactively defend against sickness at school. As a busy mom and business owner, I love that I can support my immune health without needing to run to a clinic. And let's be honest, most of the time, when my kids get sick, it tends to be at night when clinics are closed anyways. Simply O3 makes it incredibly accessible to bring the power of ozone therapy into your home. Their equipment is easy to use and designed with safety in mind. And because you're part of the MyoHacker community, Simply O3 is offering 10% off your purchase when you use the code MyoHacker. Just head on over to simplyo3.com to check out their ozone generators and supplies and use the code MyoHacker at checkout.
You are not.
So what do
hemoglobin
people
anemic.
need? What do they need to do to test that? What tests do they need to ask for?
In an ideal world, run a ferritin and an iron panel, because it's very rarely do we want to look at just one thing. Now, I say this, I absolutely will run a CBC and a ferritin, and I will just know the ferritin's going to come back crap. And I'm like, I'm not going to make you pay for a whole iron panel. And I really should. If I really wanted to know everything, I would run an iron panel, a CBC, and a ferritin. Because then if you're transferrin, and not all labs have transferrin as part of the iron panel. You want transferrin and TIBC and serum iron and ferritin. So you want to see all of those numbers. If you're ferritin, and what's great, our lab values, can we just talk about lab values real fast?
Please, yes.
Lab values of what is normal are set by the individual labs. It's why each individual lab can have different numbers. And the way that they do this is they do not have to have more than 200 volunteers. Now, typically they will have more. They will have like 100,000. But they take blood samples from people who say, I'm healthy. Hey, Karindy, I'm going to throw myself under the bus. I have not personally seen a doctor in 15 years. Healthy? I haven't been diagnosed with anything. Now, I've self-diagnosed all sorts of things, and I am relatively healthy in a number of aspects. But we're taking these numbers primarily from men and applying them across generations, ages, sex, and it doesn't work. So the range for ferritin from CPL, which is my lab, is 15 to 300. This is not a functional range. You cannot have that big of a range. It's functional. If you are under 150 going into pregnancy, we're going to have problems, because even if we do oral supplementation, you are going to drop 100 points through your pregnancy just from growing a baby. We expect you to.
So when you have a ferritin level of 8?
14. I just had someone come back with a 14. Did you say 8? I've seen that too.
Sorry.
Yeah.
So what would that mean?
It means your body's going to zoom it around. It means you're going to be freaking exhausted or completely anxious or completely depressed, or you are going to have night sweats, or you are going to have burning tongue, or you're going to have reflux, or you're going to have all of these symptoms because your body is screaming, oh, help, 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 help. Your hemoglobin is going to fall. I'm going to brag. None of my clients who have done the iron supplementation I've suggested have hemoglobins under 12 at the end of pregnancy.
It's amazing.
In modern medicine, this is unheard of.
It is.
I just had a mom who hemorrhaged, and we went into the hospital. No, she didn't hemorrhage super badly. She hemorrhaged enough for me to call it a hemorrhage. And there were other reasons we had to go to the hospital. But when they ran her hemoglobin, after blood loss, It was 13.4.
That is such a win. After
So
blood loss,
like,
you had her. Wow.
so she was not symptomatic of a hemorrhage. She didn't go into shock. She didn't feel lightheaded. She didn't
It's
look
incredible.
pale. She had the capacity to handle that blood loss. Now, I don't think you should hemorrhage. Don't hear me saying hemorrhage is fine. It's not. But when you enter into birth with an appropriate ferritin, and we're gonna fall. I absolutely expect at the end of pregnancy, your ferritin's going to be like in the 40 to 80 range if you're doing appropriately. Even if it's in the 20s and your hemoglobin is so high, I'm fine. You are giving your baby enough iron because you're also in that third trimester setting up baby's iron storage for the next 2 years. So if you are not giving your body enough iron, and it is drowning. You have a ferritin of 8, and it's robbing from every place it can find it to give to the baby. Your baby is likely going to be born slightly anemic, not enough for the lab to fuss, but enough that it's probably going to affect them in that first 2 years of life because they don't have storage to make it to 2 years. And then you're also going to be having those physical symptoms. And if something does happen where you do hemorrhage, you're going to be less likely to handle it well. You're going to have a harder time. Now, the cool part is our bodies are ingenious. And postpartum, once you start lactating, your body sucks that iron up. It's designed to remineralize in the first 6 weeks postpartum. So I can
Wow.
have somebody that we were hanging out. I had one person that she was like, I'm not going to do an iron infusion. I'm not doing IVs. Okay, fine. And we did iron supplements. And she hung out around the 20s for her entire pregnancy. I was like, that's fine. It's not dropping. And that's huge. We just don't want it to drop much. Like I can drop a few points. We just want it to stay in the 20s. It'll be fine. And then we reran her blood work postpartum and she had stayed diligent on her minerals. And
Hmm.
6 weeks postpartum, her ferritin was 130. So like our bodies are designed to eat that up after our baby is born and be like, thank you. We worked really
Hmm.
hard. So you can remineralize, especially in those immediate 6 weeks. It's also, again, it's why I do what I do because I can go, hey, I know supplements in your head were till the birth. However, this is the time to keep doing them to remineralize and set yourself up for success literally for the next 40 years. Let's keep on the supplements. Not a lot of iron is in breast milk, but your body's going to build up your iron storage so that if you have another baby, you've got the support.
That
So
is huge.
it's very cool and very huge.
So speak to oral supplementation for ferritin versus getting infusions.
I mean, that would say that's a risk and benefits conversation for every single person as an individual. Iron infusions in this country got a really bad rap. There is a medication that was used in the early 1900s, I want to say 1920s, that was terrible. And I can't remember the name. It like killed like 95. It was terrifying.
1920s. Can we just
Yeah.
say, okay?
But this is that culture of in our brains, it's passed down through the medical culture. Iron is going to kill people. You're going to overdose them on iron. You're going to murder them. And it's very strong. People are very scared of iron. Now, if you have hemochromatosis and you give somebody an iron infusion, you are going to kill them. Don't do that. You absolutely have to have the blood work on board first. The problem is it's so entrenched in the mainstream medical system. Iron is terrible. You're going to overdose and kill somebody. And also these numbers and not knowing that labs are basically making up those numbers and they're not specific to gender. And we've got women who need all this iron. Men tend to keep iron. They don't menstruate, they don't have babies, they're not, typically they're not losing blood. You can have like GI.
Like eosinophilic esophagitis where they're bleeding throughout and yeah, things like that. Crohn's,
Yeah,
all that stuff. Yeah.
all of that. So you can have those reasons and you can see men who are low. But typically men sit in the 120s and beyond easily without even trying. Women do not. Women are sitting. I ran somebody's ferritin and she lives out in the country. She does eat liver. She has steak and kidney pie. Like she does all the things she absolutely should. She's also had 4 other kids and her ferritin was 96 and I was jumping for joy. I was like, this is amazing. And that's at the beginning of her pregnancy. I have also had somebody who was vegan and came in with a ferritin of 2. I'm like, this is terrifying. Her hemoglobin's fine. So
Of
if you
course.
just run basic lab work, you go,
Yeah.
you're fine. She's going to have all these symptoms going on, but fine. So infusions are person to person specific. In my opinion, if you come into pregnancy and you are under 20, we need to talk about the option of an iron infusion. We need to talk that it is oxidative stress. Okay. Because oxygen is stress. Oxygen is oxidative stress.
Yeah.
Iron
Yeah.
is going to increase your oxidative stress. However, there are ways to combat that, like getting a Myers cocktail infusion, which has glutathione and vitamin C and your B vitamins and magnesium and zinc, all these antioxidants. So you can like find a balance, right? So we want to balance those two things. Ferritin an iron infusion kind of jumpstarts your system and
Mm.
it'll get you where you need to be quickly. But then if you're pregnant, you must continue oral supplementation. Otherwise, your body's going to go, oh, thank goodness we really needed that. We're going to use it all up.
Hmm.
And then you're going to crash. So I do like iron infusions if we're under 20. That makes me nervous. If we're over 20, let's talk about it. You are going to have to be very, very diligent. If you're under 40, we're still going to talk about there's an option for iron infusion. Um, if you are over 40, let's talk about this iron supplement. I have two that I recommend, and I only recommend two: Proferrin and Three Arrows. And Three Arrows comes in and out of stock, so it doesn't hurt to have a Proferrin bottle in your household. Those are blood-based iron supplements. So my vegan
Mm.
clients can't take those. They have to be on like ferrous bisglycinate or another vegetable source of iron. The problem with vegetable sources of iron is that our body absorbs 3 to 5%. And with,
Wow, that's all?
yeah. So like if you
Oh my
Google
gosh.
vegetables high in iron, they'll be like spinach and kale. Well, kale's not actually that high. But the problem with those are there's a lot of phytates,
Mm.
and phytates block absorption of iron. So you can have all the broccoli and spinach you want. You need to cook it to reduce the phytates. You also need a ferrous bisglycinate, but your body's going to have to work harder to actually make it bioavailable. And so you just absorb less of it. So lentils, you need something like 5 cups of lentils, cooked lentils per day
Hmm.
at the end of your pregnancy in order to just give the baby the 2.5 milligrams that the baby needs to continue to grow. So that's a lot of
Wow.
lentils. And I'm not saying, I know, there's a lot of lentils. I'm pretty sure, because I just had a vegan client, I was like, you have to have lentils. Like, you have to have so many lentils. You have to have a ferrous bisglycinate supplement. We need to do all of these things because her ferritin was really low. Not two. She was not my two client. If you're a meat eater, then the Three Arrows of the Proferrin are better absorbed, like 30 to 50%. Animal sourced iron, we absorb 30 to 50%. So that's 10 times the amount. Proferrin and Three Arrows are the only two brands I know of that can actually raise your ferritin level. Getting any old iron supplement, you're not really going to raise your iron level. Also, those sources shouldn't have the GI impact.
Speak to that because I see a lot of kids who are on different supplements, and not so much now, but before I was in private practice for myself, I would see a lot of patients who are on, they're on this multivitamin minus iron. Why? Why do our bodies sometimes have a response to the iron?
The synthetic or vegetable sourced iron, and usually it's synthetic, it's ferrous bisglycinate. That's the number one iron source when you're putting it in a supplement, will constipate. And it will constipate pretty impressively and pretty quickly. Now, you can balance that with magnesium, and you don't want to take the two together because their magnesium and calcium will compete for the same ion as the iron. And so magnesium and calcium win. And then your body doesn't pick up the iron. So I'm like, magnesium and calcium go at nighttime. And this is that whole like one size doesn't fit all. One size doesn't fit all. If you have somebody who can be on top of, okay, we're going to have iron in the morning, we're going to have magnesium at night, great, we should do that. If you are just trying to get a multivitamin in and like kind of cover some bases because your kid is a picky eater, sure, I get it. My kids hate me because I am. And that sometimes means they don't take all the supplements because mommy was out of birth and forgot to
Yeah,
be
yeah, yeah.
like, it's nighttime vitamin time.
Yeah.
And they're like, we're off. But it's a pain and it's not fair. There's all this other
Mm,
mental load stuff going on. Hey, I'd also like you to remember that you should take iron C and vitamin B in the morning. I want you to take calcium, magnesium, and zinc in the evening. And like it's just not fair. But in our multivitamins, the knowledge is power
yes.
and ignorance is supposedly bliss, but it's a pain because those multivitamins often put in, first of all, too few vitamins at too low a dose, and they put in vitamins that compete with each other for
Hmm.
reception. And so you take this multivitamin and you're like, I'm doing great because I'm taking this multivitamin. It also can be in a nutrient that you specifically don't need and cause problems. So,
Right.
like, if somebody, like, I can't take, there's this really good prenatal that probably most women should take most of the time. It's called Needed. I can't take it. There's too much selenium. My body has so much selenium. It's very good. Thank you very much. When I take selenium supplements, I am nauseous. I am possibly going to vomit, and I don't vomit. Like, it's going to have a very heavy GI impact on me. So, iron's one that can have a very heavy GI impact, and it's more common to have that, and there's not going to be enough magnesium to counteract that. But it also is not going to be in a children's vitamin because you're going to overdose them. You're going to kill them. You can overdose with iron. We don't know a good dose. We barely know good dosages for women.
Right.
We don't know at all dosages for children. Pediatricians don't know dosage for children. I have an amazing pediatrician that a client of mine was like, hey, you know about vitamins, you know about nutrients. What can I do for my kids? And I'm like, what do you mean? I don't want to speak outside of scope. She's like, well, there's these dosages. And like, I know that for me, you said split up these vitamins and I really only need these and I don't need that. So I'm just doing these separate ones. What about kids? And
Hmm.
I'm like, you are going to have to ask your pediatrician. I
Yep.
don't know RDAs or FD, like, I don't know the research on kids. And I hope to gosh, there is a pediatric version of Lily Nichols or a pediatric version of Sarah Thompson doing this research for kids.
Right. Right.
But I don't know what it is, and I don't know how to tell you. Ask your pediatrician. This pediatrician's great. She's like internal medicine. She's wonderful. And she basically was like, and just give them a multi. I don't know it about that. So we
Wow.
don't know. We just
Which
don't know.
is, again, your first point, labs. Why you want
Labs.
labs.
And
Just
then
with
tell
everywhere.
somebody to try and get lab work on their kid.
There.
They
Ugh.
don't want to.
Yeah, yeah, yeah.
I have a 12-year-old who has already told me I'm not getting grandchildren. Why? Because she doesn't want to do blood work.
Well, there you go.
So like she knows that her iron is low because we've talked about enough of
Mm,
the symptoms and she's like, I am constantly frozen. My hands and feet are constantly frozen. I know I need iron. And I remember to take it when I'm on my period because that's when it's really bad. I'm like, yeah, it's not really going to do much good unless you take it the other 3 weeks of the month. She's like, well, I remember one week.
right? Which at least she's doing that.
Which,
At least she is
yeah,
doing that. So,
yeah.
could we talk about connective tissue concerns with
Mm.
pregnant women? Because if
So,
we're talking about tongue ties, tethered oral tissues, it is not uncommon for us to
so,
have some of these issues.
so like hypermobility. Are we talking about hypermobility?
Yes, yes.
Yeah, I have a lot of clients that I tell them they're hypermobile. Do you want to know why? The
Why?
first time they go to give blood, I'm like, okay, I want you to extend your arm
There.
all the way. And they go, "Whoa," and you go, okay, so has anyone ever told you about hypermobility? And then we do the, what is it called? The starts with a B scale. The like the thumbs back towards
Yeah,
the,
yeah,
and
yeah, yeah.
then elbows and knees. And have you ever done the splits? Have you ever been able to do the splits? Well, yeah, but I worked really hard at them. I don't care. You're hypermobile. Most dancers are hypermobile. And so we
Mm,
do have this, like if you've already had kids, I'm like, do you feel like you're extra klutzy when you're pregnant? Well, yeah, but everybody does. Right. But like I had one client that she sprained her ankle every time she was pregnant because she would always roll her ankle. I had one client who banged into counters all the time. And it's just that like we've got that hypermobile. So when we've got a hypermobile mom with low iron, tongue tie, we're also going to be talking about some neurospiciness.
yeah, we
We're also
are.
we're going to be like, okay, friend, you hired me as your midwife. I'm not telling you that makes you neurospicy. I'm saying I don't get along with people who aren't neurospicy.
There we go. Yes.
So there's probably some element of neurospiciness. We've
Which
probably got some
what does that
hypermobility.
mean for all the non-hip kids?
Oh gosh, because I don't love these labels. I
I
don't
know.
love them because they feel like, okay. Do you know who Robert Sapolsky is?
I do not.
Okay, well, let me send you down another nerd fun
Please
hole.
do.
Okay,
Please do.
so he is a Harvard professor who is a behavioral biologist, and he is fascinating. And he talks about his book is like why zebras don't have ulcers. Um,
I do know. Okay, yes, I know
okay,
the book. Yes, yes,
and the
yes.
new book is Behave, and then I think he's got a new one that's come
Yes.
out even since Behave. Okay, him. So he talks in his lectures a lot about the difference between where's the line between pathology and normal, right? He's like, OCD, he goes, counting steps. When I'm very anxious and I'm climbing the stairs and I don't want to think about the test, I'm going to count my steps. Does that mean I have OCD? I don't know. Where's the line between pathology? Do I feel like that's impacting
Yeah.
my life? No.
Yeah.
And so he uses himself as an example, and I love that. Where's the line between pathology and physiology? For neurospiciness, the typical labels included are things like OCD, autism, ADHD, bipolar. Let me think. What else? Throw some other ones out there, Candy.
I think that is a great place just to start. Basically, not neurotypical. What someone considers, like may have had an IEP growing up. You may have needed extra supports.
Yeah. Or you were in the GT class.
There we go. Yeah, there we go. Yep, there we go. Gifted
You
and
were in the
talented and
GT
a
class,
little
and you
anxious.
did, and you did so good. If you would just apply yourself a little bit more, if you would just stop talking so much.
Yeah.
You, like it's
Just
those kind of
apply
comments.
yourself. Just
Just apply
apply yourself.
yourself.
Stop being lazy. All those
Oh,
things.
yeah, it's
Okay,
that.
so now you guys know neurospicy is going to be this neurodivergent,
Neurodiverse.
not quite on that neurotypical pathway. So,
Small talk really bothers you.
well, now we're going into the symptoms of different
Right.
kinds.
So
So, yeah,
if you've got this like profile, you're likely to also have either a POTS or a hypermobile or both. And then we're talking about like EDS, which is Ehlers-Danlos syndrome. And I think there's a lot of this underdiagnosis of these things because a lot of times women, we're really good at fitting in. And so, like, we smile and we make it work. And then we're also really good at gaslighting ourselves because we probably were gaslit as children. And, like, oh, that doesn't hurt that bad. It's not really like because we've like indoctrinated ourselves. Yeah, my pelvis is a little sore, but like it's fine. And then you end up at like PT because now you're 40 years in and you've got sciatica shooting up and down your back and it's so bad you can't breathe. You're like, okay, now it might be a problem. Like, there's lots of things that go with that profile. And when you're pregnant, I absolutely have people where pregnancy makes it easier. I have people where
yeah,
pregnancy makes it significantly worse. So I have hypermobile people who are hyper interoceptive. They're really good at knowing what's going on in their body. And now they're pregnant. And now there's all these new sensations. And so
mm,
the overstimulation likelihood is significantly raised. It's very easy for them to get overstimulated because they are having all these new sensations and they can't turn it off. They can maybe push it to the background, but it's still sitting there. And the baby is moving, and oh gosh, the baby's moving, and I have to be aware of it. Some brain part of me has to be aware of the baby, and now I can't concentrate on this, that, or the other. A lot of people, they're like, no, it was easier to focus. It was easier to exist and have life. But sometimes it means more joint pain because that relaxin comes in. We're already hypermobile, and now it's extra. So it's never boring. And it is always an effort of mine to stay curious and to individuate care because everybody is different. And that's my thing. Like, there's no such thing as neurotypical. Like, everybody is diverse, everybody's unique.
yes.
But it is that, okay, how can I best support you? And some of it is, hey, here are the exercises, here are the nutrients, here's the lifestyle tips, here's the emotional tips. And
Mm,
also, you have three other kids.
yeah. Let's be real.
Let's be real. Take two things that you can implement this week.
There we
Do
go.
that. And it's just hard. Pregnancy is hard. Birth is hard. Raising kids is hard.
So I know people are listening right now and they're like, I want her for my
It's so
midwife
much nerding.
because
I love you
this,
if you still want me after this.
yes. And there are people that say, I do, I do. How can they get in touch with you? What can they do?
So my website is www.spiralpath, like garden path, PATH, midwifery.com. and you can go there and there's a lovely contact us and like schedule a consult. And so there, I'm happy to talk to anybody that way. And sometimes it's just a FaceTime or a Google Meet, and sometimes it's in person, and then we go from there.
And you're also on Instagram. What's your handle
And
there?
on Instagram.
Yes,
I think
yes.
it's at Spiral Path Midwifery.
Yes. And I will have all of these links in the show notes. And so if you're listening on your phone, just scroll down and you will see the links there listed. So you can get in touch with Melissa right away, and you can follow her because she shares just incredible gems all the time for free. Just
Yeah, so do
incredible
you.
information. Well, thank you. And that's why we're friends. We want to help people, and we want to see changes in this space.
Yeah.
Significant changes. So
Yes.
we are here for it,
Yesterday.
guys. So if you have questions, I would also encourage you, if you are a health practitioner, to reach out to Melissa, because she has a lot of knowledge, and just for consultations with her to get some of that insight. Because, you know, if I have a patient who has some TMJ issues, who is pregnant, I need to be more informed about what is going on with that context than just saying what I would do or doing what I would do with someone who is not pregnant. I think it's very important to have that information. So thank you everyone for listening today. And just, isn't it fun to talk to Melissa? It's so much fun.
Thank you, Karindy, because
Yes,
it's so fun. And
I know.
thanks for
So
letting me,
everyone,
ramble.
please share with someone you know, and just let's get this information out to as many people as we can. So please share, and rate and review the podcast. It is how the algorithm works. It has to be rated high for people to hear about it. I know, the evil algorithm. So let's go. Hey, share this information. Let's change lives. Thank you so much, everyone. I hope you have enjoyed this episode of the MyoHacker Podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information, and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at MyoHackerSLP for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.